name is Alvin. I'm from BTech Computer Science and with specialization in AIML and machine learning. What I'm presenting here is my capstone project for my Samsung Innovation Campus. So what this is basically it's my Retina Screen AI. What it does is it scans images of your eyes, frontal images of your retina to check the severity of your diabetic retinopathy. Now, the data set I have got is from APTOS 2019 data set, blindness detection data set. So what it's basically collected from rural villages and people who happen to have a diabetic retinopathy. So this is my Google file which I've used to train the model. The model I've used is CNN model, efficient V3, and it basically is a regression model, and I have trained it for 15 epochs. And coming to the accuracy of my model, I believe it's pretty accurate, almost 4 DR cases. The more 5 DR cases are no DR, mild, moderate, and severe and proliferative. Now, the model performs quite well with no DR and severe to moderate, moderate and mild diabetic retinopathy, but it does lack some accuracy when it comes to proliferative and severe because it often confuses it as moderate. So coming to my app, it's basically a fully fledged pipeline where it analyzes your image. It gives you the retinal image, and it also uses GradCam, which basically converts the original image into a heat map, and the red map connections that you see usually is what usually the model uses to this is what the model focuses to predict the severity of the DR. It also has a form for giving the risk factors. For example, you could give the diabetic duration, you could give the type of diabetes, you could give HP, you could give blood pressure, and it also checks your smoking status. And yeah, so it has accurately predicted proliferative diabetic retinopathy, and you can see the original and the heat map which is provided by the GradCam. So exactly these red lines that we see here are what usually is used by the AI to predict the severity of the retinopathy. And it also gives the grade distribution, the estimation of how similar it is to each case. And what I've used here is Grok API to provide this clinical summary and the patient risk profile. So it analyzes your severity, and based on it, it gives you a nudge or review or diagnosis. And if you happen to have more questions, or if you want to know about more about the issue, or if you want, any ways to resolve or treat the issue, there's also a chatbot that I provided that has the context of your analysis. So if I can ask, so what proliferative is like the most worst case of the diabetic retinopathy that you can have. So I could ask maybe, when will I become blind? As you know, diabetic retinopathy is also the leading factor for blindness in adults. And as you can see, the Grok API has provided me with some instructions on how I can resolve the issue. So, as what the AI says, this is not a fully clinical solution, I expect all of you to just go to a specialist or an ophthalmologist to treat and check up and see if you have diabetic retinopathy, or if you do have it, please follow and go on with your treatment. So yeah, that's my project. Thank you and take care.